Okay, so preventing chronic disease and improving wellness in the elderly. I'm Sarah Ziner. So there are 6 dimensions of wellness. These are occupational, physical, social, intellectual, spiritual, and emotional. The occupational dimension is one's attitude towards their occupation, and it's optimal to choose an occupation that you hold interest in. The physical dimension is the body's need for regular physical activity, and benefits of this dimension and doing physical activity regularly are higher self-esteem and increased confidence. The social dimension encourages one to get involved in the community. Finding your purpose and contributing to society can really improve your quality of life. The intellectual dimension promotes one to be creative and expand their knowledge. It helps to better face challenges and invest in things. The spiritual dimension is the importance to search for a meaning and purpose to life. This gives a sense of living faithful to yourself. The emotional wellness is the awareness and acceptance of your thoughts and feelings. Once you have a hold of this dimension, you can express your emotions freely and empathize with others. So, chronic diseases that I went through, one was hypertension. This is also known as high blood pressure, and it affects 1 of 3 people in the United States. This affects the physical dimension because you have to be aware of your body at all times, especially when you're exercising, because if you feel any chest pain, dizziness, or pressure in your chest, you should stop exercising. This can be frustrating for people because they can't exercise at the intensity they want to. This affects your social dimension as you might have to watch what you eat. You have to take medication when you're out with friends, and that could be pretty embarrassing. The things listed above could lead to one to feel embarrassed or feel anxious about going out with friends, being with people, and being okay with what they're going through. Another chronic disease is COPD, or chronic obstructive pulmonary disease. You can be at risk if you're exposed to pollution or if you're a frequent smoker. This affects, or statistically, 1 in 4 adults say that they're unable to work or they miss work frequently because of this disease. They miss out on doing what they love. They are unable to exercise at the level they desire because they experience pain, lack of sleep, and strength. Their emotional and social dimension is affected because it increases their anxiety, their worry, and can lead to loneliness from the people they love. Lastly, another chronic disease is depression. It's usually a constant feeling of sadness and worthlessness, and it is more common in those who have other illnesses like heart disease. It can affect their work because they can miss work and have low productivity. It affects their physical dimension because they can feel fatigue, nauseous, and get headaches. Their social dimension can be affected because they'll feel like withdrawing from the people they love. It can cause decreased levels of concentration in their intellectual dimension, like school or at work. It can also cause a feeling of hopelessness and helplessness and feel like they are also withdrawing from their spiritual life. And it can cause anxiety, worry, and sadness. Preventing chronic diseases can be tough, but there are ways to do it. In hypertension, keeping the blood pressure in a healthy range can be done by living a healthy lifestyle. This means eating a well-balanced diet, maintaining a healthy weight, being physically active, not smoking, and limiting your alcohol consumption. COPD, the risk factors are smoking and pollution, so don't smoke and be careful about your exposure to excessive pollution. Depression can be prevented by finding a way to handle stress, getting enough sleep, eating well, exercises, talking to someone, and getting help before it could get worse. Exercise is also a great prevention strategy for chronic disease. For hypertension, the heart is worked and gets stronger through exercise, which allows the heart to pump more blood with less effort. This in turn decreases blood pressure by 5 to 7 millimeters, also maintains weight, which can lead to a decrease in blood pressure. For COPD, exercise can decrease resting heart rate and blood pressure, leading to improved breathing. Improved circulation allows the body to use oxygen more efficiently. For depression, exercise releases feel-good endorphins, leading to less stress and happy thoughts. It also promotes neural growth, reduces inflammation, and new activity patterns promote calmness and wellness. Lastly, you can gain confidence and more social interaction by engaging in exercise. So the elderly. In 2012, nearly 60% were managing 2 or more chronic diseases. So why promote prevention for the elderly? Risks associated with normal aging. It's normal for older people to be more at risk for chronic diseases. There's high incidences of chronic diseases in the elderly, and most people are living longer, so they really need to start preventing chronic diseases at a young age. Benefits of barriers to exercise for the elderly include lack of interest, shortness of breath, joint pain, lack of fitness education, lack of energy, and doubt that exercise will truly change their quality of life. One way to really encourage the elderly to get involved in exercise is the social cognitive theory. This proposes that the personal, behavioral, and environmental factors interact with one another. One of the most critical pieces to this approach is self-efficacy. This allows for social support in a learning environment, and external and internal reinforcements are used, and observational learning is used. So the social cognitive theory, how can it be applied to the elderly to promote exercise and well-being? So socially, exercising offers social support, allowing the elderly to get involved with like-minded people in an exercise group and find interest with one another. So social outing they can feel comfortable in. Observational learning is used and is a great way for elderly to watch someone do an exercise so they can feel confident to reproduce that movement. There's also much to say for what the Christian worldview is on exercise. Corinthians 6:19-20 says, "Or do you not know that your body is a temple of the Holy Spirit within you, whom you have from God? You are not your own, for you were bought with a price, so glorify God in your body." The Christian worldview values human life. Jesus says our body is a temple and we must keep it holy and not destroy it. God made us in his wonderful image. So to further spread his word, we must be physically fit and take care of ourselves. And we can use our body to glorify him in all that we do, including exercise. And those are my references. Thank you.